Hello and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Today I'm joined by Jason Powell and Blake Cochran, Community Paramedics for Caldwell EMS. Welcome, gentlemen.
Thank you.
Thank you.
So I'm going to start with the obvious question. What are community paramedics?
Jason, you want to take?
Sure. So community paramedics, it is our goal and our thought is reversing 911 and reversing the delivery of EMS. So most times folks call 911, an ambulance comes. Okay.
Right.
There are a lot of gaps that are in between there, folks that fall through the wayside. So the goal and what community paramedics do are we fill those gaps. Folks from home health that don't qualify for that, and those folks that are high 911 utilizers. So trying to help our operations staff as far as reducing the amount of 911 calls that we have and also filling those gaps for folks in the community.
Talk to me about how high 911 utilizers can bog down your system.
Pretty much, because you're taking an ALS unit out of service to paramedics. Anytime we send a truck to something that doesn't require ALS services, maybe it's just a lift assist, it's a check welfare, something that's not major, doesn't have that emergency feeling or need. So we can keep them in service, send one of us there to help with that call, and just kind of utilize that instead of utilizing 911 and a full ALS crew. So it kind of just keeps them in service. And
Okay,
maintains.
for people who don't know, when you say ALS, what does that mean?
Advanced life support.
Okay.
Yeah.
So really you are a bridge for a lot of people.
Absolutely.
And you've been doing this for a little over a month now. You started April 1st. What have you seen in the community as you've been out visiting with patients?
Sure. So in the community, what we've seen is basically folks we've identified as those high 911 users. We've gone, introduced ourselves, seen what they need. Not everybody needs medical attention. Some folks need home assessment, home safety assessments, fire alarms, smoke detectors, carbon monoxide detectors. The handrails are not working, fall risks throughout the home. And so we're able to help themselves by identifying this for them, and we're able to document that in our services.
For these patients, I don't know if you call them patients or clients.
We're calling them clients.
Clients.
Yes,
So
yes.
I think that's a much better word.
Sure.
For your clients, how much does your service cost?
This is actually a way that we give back to the community, so we're not actually charging for this fee right now. So it's kind of a benefit for them, also offering them services that they didn't know exist. It just brings them all the resources that they know they have. But it's a way we give back to the community.
So as you're reaching out, you've identified a certain number of people already. From here, where do you go? I know you, when I say just started, you really are just getting into this. But can people call if they think you might be a good fit at this point, or are you just working with that specific group of people?
So currently, we're not what we say live. Right now, for a better term, we're in our beta phase. We're testing. We're working with other North Carolina programs to try and develop our own. We're literally building it from the ground up. So we are identifying and helping as much as we can those folks that are the high users currently. When we go live, we'll have identified our first set. We're going to identify 10 patients for Blake and 10 for myself that will be on our caseload. So once we have them in our caseload, we'll hopefully be able to work through them and then cycle through and identify more. Obviously, there'll be more that arise during that time frame that we're able through the normal 911 operation. So as they come, we'll be able to identify and again, fill the gaps.
And there are other programs similar to this in other counties. Can you talk about what kind of experiences those counties have had, just as you've studied them?
We've modeled kind of our system after McDowell, but no system is a cookie cutter program, so we kind of changed a few things. Theirs was a call volume. I think they reduced theirs by 20%.
20-some percent.
20% in 2 years, which is huge in the 911 call world. I mean, that's a lot of ambulances stopped that weren't needed, that they were able to fill those gaps, as Jason said.
For you, as a career move, you're going from what I would call a high octane calls to more of a support role. How do you feel about that? I know you both sought this position. It wasn't something you were like, talked into, but talk to me about what drew you to that role.
Sure. Well, for me, since I came down, I came to the county 6 years ago. One of the pitching points, I guess, during my interview was community paramedic program, special operations, tactical medicine as well. I was interested in all three of those. I'm on the special operations team, and now I'm one of the community paramedics, where Blake's on the tactical team. So for the high octane, we're still able to get our fill, because we're now transitioned off of the regular shift on a 911 ambulance all the time. Now we're 8 to 5 administrative staff. So we are helping with those high acuity calls, close proximity to where we are. We are running the lift assist. So it's basically, for me, it's the best of both worlds. We're able to get to those calls where you're truly needed, and then we're also able to find the folks and identify them that truly need the help and just need access to resources and education.
Blake, what drew you to this program?
My wife, her family, grandmother lives in Marion, which is the kind of the system we modeled from McDowell. I was up there visiting her, and she actually had a community medic come out and check her while I was there. And I was like, oh man, this is really neat. I've never really seen it. I'd read about it, but I'd never really seen it in person. So it kind of got me really sparked. Started doing a lot of research and talked to Jason and found out the program was going to come here. And to me, this was a really good fit. I love trauma. I love everything. But this, I think you get to gauge and see how well that you really get to help these people in need and bring it to them.
And you've already started your visits.
We have.
We have, absolutely.
Tell me about some of the needs that you're seeing.
A big thing here is transportation issues, education on their just different things, diabetes, congestive heart failure. A big thing is education here. They just really need to be educated on how to use stuff and their diagnosis. I was trying to think. Doctor's appointments is a big one, getting people scheduled for doctor's appointments, and just connecting the dots, like filling in the gaps, like Jason said. We just really all about the resources, connecting them to it and bringing them.
A lot of CP programs or mobile integrated health programs are derived using hospitals, and ours we're driven more from the EMS side, from 911 aspect of it. So the reduction in those readmittance to the hospital, those reductions in the hospital, the emergency department visits, those are kind of the areas where we're trying to fill those gaps and to educate folks that once you go to the emergency department, you really must follow up and follow those directions that physician has given you during that discharge. It's amazing to see that the people that just let it go to the wayside. And I think just a little push from Blake or myself, we've already started to see that productive aspect of it.
When you visit a client, do you have a certain procedure that you work through? Do you check their blood pressure? Or is there something like that takes place? I mean, I know that's real high level, but can you talk to me about that?
Since we're in the beta phase right now, we're not really doing anything set in stone. So we pretty much go out, introduce ourselves, tell them about the program, say, hey, we're here, Caldwell County EMS, rolling out this new program, show you how it'll benefit you. We'll do a basic set of vitals, do a home safety assessment, and just see what they kind of need as far as our side to connect them to it. Nothing really just set in stone right now.
Right. Not quite yet.
Yeah.
You're not quite there yet.
Yeah.
The other side of it is connecting with resources in the community.
Correct.
If someone watching is a community resource that might help you, how can they connect with you?
Sure. So we have identified actually an email address. It's Caldwell CP program at Caldwell County NC.org. Correct. So that's an email address that we're publicizing and letting anybody get out to us. If they want to call just the normal, our normal admin office and speak to our administrative assistant, she can get in touch with us. And once we start to visit, and we have our phones that we're able to be in contact with folks.
Sure. But if people are, a resource and they want to connect with you, we want to make sure that they can do that.
Absolutely.
Because
we welcome it all.
Oh, yeah.
Anything we've forgotten? Because I feel like this is so broad, but it's also so new.
Right, it is. It's, you know, I'm learning daily. I know Blake's learning daily. It's a redelivery of the 911 EMS system. It really is, to the point of, you know, we have different software that we're having to use to be able to document this. You know, this isn't just a 911 call. These are ongoing patient records that we will continuously have, and that will be, you know, their medical records forever. So we're learning to deal with that. We have, with our new system, we're going to be able to offer telehealth as well, which is a hot topic in emergency medicine, and especially during the pandemic.
Oh, yeah.
You know, community medics in the larger cities are being used, you know, daily on their shifts to go do testing and such. Thankfully, we're not there here in Caldwell County. We do have quite a few, but we're not there. We've got our respiratory diagnostic center that we've been able to use, and but no, there's, like I said, we're learning daily.
Yeah.
You are learning daily, because I've had the privilege of sitting next door to you for your first month, and I hear you on the phone making those calls, and it is a learning curve for you, and an education, you know, for your clients.
Yes. That's a part of our slogan is the CARES, and it's creating access to resources, education, and services. You know, because a lot of folks don't know that what we have and what we have to offer here in Caldwell County.
And I think, before I forget, it's important to note that you don't have an age requirement on your services. I mean, at least at this point.
Correct.
We don't. Yes, ma'am. As far as some of the resources out there, they're kind of age restricted, but we don't for the program side.
Which that actually helps fill in some of those gaps.
Definitely.
Absolutely.
Gentlemen, thank you for joining me.
Thank
and
you.
I
Thank
hope when we get this program in the next phase, you'll come back and talk to us again about what you have.
Would love to. Absolutely.
Definitely. Thank you for having us.
Thank you so much.
And thank you for watching Caldwell County Today.